12 vitamins you should avoid use together. No one says that. Have you ever wondered if all the supplements you take are really necessary? What if I told you that some combinations of vitamins can interfere with each other's effectiveness? Would you consider that too much of certain nutrients can have counterproductive effects? Millions of people combine supplements daily without knowing about possible interactions between them. Responsible supplementation requires knowledge about how different nutrients interact in the body. Scientific studies have revealed that interactions between vitamins can affect their absorption and metabolism. Some combinations can reduce the effectiveness of supplements, while others can lead to unwanted buildup. It is important to consult with healthcare professionals before starting any supplementation regimen. What you'll learn today is based on scientific research published in respected journals. Doctors and nutritionists recommend a careful approach when combining different vitamin supplements. Let's get started. What scientific research says about vitamin combinations? Medical science has extensively studied how different vitamins interact in the human body. Researchers have found that certain vitamins compete for the same intestinal absorption mechanisms. This phenomenon can result in reduced effectiveness when specific vitamins are taken simultaneously. Studies published in the American Journal of Clinical Nutrition show that iron absorption can be affected by vitamin C. When there is an excess of certain nutrients, the body has to work harder to metabolize them properly. The liver's detoxification systems can become overwhelmed with excessive or inadequate supplementation. It is important to remember that vitamins are biologically active compounds that affect multiple processes in the body. Longitudinal research has followed patients who use multiple supplements for long periods. The results show the importance of appropriate dosages and well-studied combinations. Healthcare professionals who specialize in nutrition can help customize a safe supplementation regimen. The National Institute of Health maintains up-to-date guidelines on known interactions between nutrients. Always consult with reliable sources and qualified professionals before making changes to your supplementation. Knowledge about these interactions continues to evolve with new research. How excess nutrients can affect your body. The human body functions best with a delicate balance of vitamins and minerals. Studies show that too much of certain vitamins can interfere with the absorption of others. When we consume more than necessary, the liver and kidneys work to eliminate the excess. This process can generate metabolic byproducts that need to be processed by the body. Research indicates that inadequate supplementation can lead to nutritional imbalances. The term "more is better" does not apply when we talk about vitamin supplementation. Some fat-soluble vitamins can accumulate in fat tissue when consumed in excess. This accumulation can interfere with normal cellular processes and liver function. The key lies in finding the proper dosage for your specific individual needs. Regular blood tests can help monitor your nutritional levels and prevent overeating. Medical experts recommend a personalized approach based on your individual health. Many people respond better by getting nutrients from varied foods rather than isolated supplements. The bioavailability of vitamins in whole foods is often superior to that of synthetic supplements. Consider working with a dietitian to develop a balanced eating plan. Understanding the interactions between different vitamins can be of different types: synergistic, antagonistic, or neutral. Synergistic interactions occur when vitamins work together to enhance their mutual effects. For example, vitamin D helps with calcium absorption when both are present. Antagonistic interactions happen when one vitamin interferes with the absorption or function of another. A well-known example is how large doses of zinc can interfere with copper absorption. Researchers continue to discover new interactions as they conduct more detailed studies. Individual metabolism varies, so what works for one person may not work for another. Factors such as age, genetics, health conditions, and medications all influence these interactions. This is why generic recommendations may not be suitable for all individuals. Healthcare professionals can interpret laboratory tests specific to your needs. Documenting your symptoms and energy levels can help gauge supplementation effectiveness. The science of nutrition is constantly evolving, with new discoveries on a regular basis. Staying informed through reliable sources is essential for conscious health decisions. 12 combinations that deserve special attention. 1. Vitamin A and vitamin E. Competition for absorption. Both vitamins are fat-soluble and can compete for absorption in the intestines. Studies suggest that high doses of vitamin E may reduce serum vitamin A levels. This interaction is more relevant when both are taken in high doses simultaneously. Vitamin A is essential for vision, immune function, and cell development. Vitamin E works as an antioxidant, protecting cell membranes against oxidative damage. When one interferes with the other, both can have their effectiveness reduced. Experts suggest taking these vitamins at different times to optimize absorption. People who consume diets high in healthy fats generally absorb both vitamins better. If you use supplements from both, consider alternating or different forms of supplementation. Foods rich in vitamin A include liver, carrots, and dark leafy vegetables. Natural sources of vitamin E include nuts, seeds, and cold-pressed vegetable oils. A varied diet usually provides adequate amounts without the need for excessive supplementation. 2. Vitamin C and vitamin B12. Stability issues. Vitamin C can degrade vitamin B12 in aqueous solutions within the digestive system. This interaction is more pronounced when both are present in high concentrations simultaneously. Vitamin B12 is crucial for blood cell formation and neurological function. Vitamin C is important for collagen synthesis and immune function. Studies show that spacing these vitamins out for a few hours can prevent negative interactions. The form of B12 used also influences. Some forms are more stable than others. Patients with B12 deficiencies should be especially careful with this combination. Vegetarians and vegans who frequently supplement B12 should be aware of this interaction. If you take both supplements, consider taking them at least 2 hours apart. Foods naturally rich in vitamin C include citrus fruits, strawberries, and peppers. B12 is found primarily in animal products, making supplementation necessary for many vegetarians. Consult a professional to determine the best ways and times for your supplementation. 3. Vitamin D and calcium. Balancing absorption. Vitamin D is essential for proper calcium absorption in the gut. Although they work together, excessive doses of both can be problematic. Too much calcium in the blood, hypercalcemia, can cause a number of health problems. Symptoms may include nausea, weakness, confusion, and kidney problems in severe cases. Vitamin D facilitates intestinal calcium absorption very efficiently. It is important to monitor blood levels of both when supplementing, especially at high doses. Many factors influence how much vitamin D and calcium you need individually. Age, sun exposure, skin color, and medical conditions all affect your needs. Regular blood tests can help determine appropriate dosages for you. Natural sources of calcium include dairy products, leafy green vegetables, and fish with bones. Vitamin D can be obtained through moderate sun exposure and fortified foods. A healthcare professional can help determine if you need supplementation. 4. Vitamin E and iron. Different absorption needs. Iron can interfere with the absorption of vitamin E when taken simultaneously. This interaction is most relevant for people with iron deficiency who need supplementation. Vitamin E is an important antioxidant that can also affect blood clotting. Iron is essential for the transport of oxygen and the function of many enzymes. Taking these supplements at different times can optimize the absorption of both. Vitamin C can aid in the absorption of iron when taken along with ferrous supplements. People with iron deficiency anemia should be careful about adding vitamin E to their routine. Coffee and tea can reduce iron absorption when consumed closely. Natural sources of iron include lean meats, beans, and fortified cereals. Vitamin E is found in nuts, seeds, and vegetable oils. If you need to supplement both, consider consulting a nutrition specialist. 5. Vitamin B6 and zinc. Moderation is key. Both are important for immune function, but balance is crucial. Excessive doses of vitamin B6 can cause temporary peripheral neuropathy. Too much zinc can interfere with the absorption of other essential minerals. Vitamin B6 is involved in protein metabolism and neurotransmitter synthesis. Zinc is needed for more than 200 enzymatic reactions in the body. Following the recommended dosages is especially important for these two nutrients. Many foods contain both nutrients in amounts suitable for most people. Sources of B6 include poultry, fish, potatoes, and unprocessed grains. Zinc is found in meats, legumes, nuts, and seeds. Excessive supplementation of both can cause more problems than benefits. If you choose to supplement, strictly respect the dosages indicated on the products. 6. Vitamin C and copper. Necessary precautions. High doses of vitamin C can reduce the body's absorption of copper. Copper is an essential trace mineral for the formation of connective tissue. This interaction is usually only problematic with very high doses of vitamin C. People taking megadose vitamin C supplements should monitor copper levels. Most people get enough copper through a varied diet. Signs of copper deficiency can include anemia, bone, and neurological problems. Foods rich in copper include seafood, liver, chocolate, and nuts. Vitamin C supplements are generally safe in the recommended doses. Excessive doses can cause digestive discomfort in addition to affecting mineral absorption. If you use high doses of vitamin C, see about mineral monitoring. 7. Vitamin D and vitamin A. Shared receptors. Both fat-soluble vitamins can compete for similar cell receptors. This is a complex aspect that is still being researched by the scientific community. Vitamin A is crucial for vision, cell growth, and immune function. Vitamin D is essential for bone health and has multiple regulatory functions. In appropriate doses, both can work synergistically for overall health. Excessive doses of any of them can interfere with the function of the other. It is important not to exceed the tolerable upper doses established for both. Laboratory tests can help monitor adequate levels of both vitamins. If you are supplementing both, consult about appropriate dosages for your case. Most people get enough vitamin A from a varied and colorful diet. 8. Vitamin K and anticoagulants. Known interaction. Vitamin K is essential for blood clotting and can interfere with blood thinners. Patients using warfarin or similar should maintain consistent intake of vitamin K. Sudden changes in intake can affect the effectiveness of anticoagulant medication. This is one of the most well-documented and monitored interactions in medicine. Always tell your doctor about any supplementation if you use blood thinners. Many leafy green vegetables are naturally rich in vitamin K. It is important to maintain a consistent diet if you are on anticoagulant therapy. Changes in supplementation should always be discussed with your cardiologist. Regular coagulation tests are required for patients on anticoagulation. Supplements containing vitamin K should be avoided without medical advice in these cases. This interaction requires constant medical surveillance for patient safety. 9. Vitamin B3 and alcohol. Liver precautions. Both are metabolized by the liver and can overload this organ in high doses. Niacin, B3, is used therapeutically for cholesterol, but it requires medical supervision. Alcohol can interfere with the conversion of B3 into its active form. This combination can be especially problematic for people with liver disease. If you use B3 supplements, consider moderating your alcohol consumption. Prescription forms of niacin require monitoring of liver function. B3 supplements in high doses can cause a characteristic flush. Patients with a history of ulcers should avoid some forms of niacin. Always consult about interactions between supplements and your current medications. If you have liver conditions, this combination deserves special attention. 10. Vitamin A and iron. Controlled synergism. Vitamin A can help mobilize stored iron in the body. While they can work together positively, balance is important. Too much preformed vitamin A can be toxic, especially during pregnancy. Iron also needs to be carefully dosed to avoid excessive buildup. Both nutrients are best obtained from varied food sources. Lean meats provide heme iron, the most easily absorbed form. Orange vegetables provide beta-carotene, the safest precursor to vitamin A. If you supplement both, monitor with periodic laboratory tests. Signs of excess vitamin A include dry skin and liver problems. Excess iron can be dangerous, especially for people with hemochromatosis. 11. Vitamin D and magnesium working together. Magnesium is necessary for the conversion of vitamin D into its active form. Magnesium deficiency may reduce the effectiveness of vitamin D supplementation. Both work together on bone health and muscle function. This is one of the combinations that can really benefit when well balanced. Many people have inadequate magnesium intake in modern diets. Magnesium is present in dark green vegetables, nuts, seeds, and whole grains. If you supplement vitamin D, consider checking your magnesium levels. Symptoms of magnesium deficiency include muscle cramps and irritability. The appropriate ratio between these nutrients is individual for each person. Laboratory tests can help determine your specific needs. 12. Vitamin E and selenium, complementary antioxidants. Both function as antioxidants, but different mechanisms. In appropriate doses, they can have a positive synergistic effect. Selenium is necessary for the production of glutathione peroxidase, an important antioxidant. Excess of both can have counterproductive effects on oxidative stress. The more is better rule definitely doesn't apply to antioxidants. Excessive doses of selenium can cause toxicity, including hair loss. Too much vitamin E can interfere with blood clotting. Food sources include Brazil nuts, selenium, and nuts, seeds, vitamin E. If you choose to supplement, respect the tolerable higher doses. A varied diet usually provides adequate amounts of both antioxidants. Each person has different needs based on individual factors and lifestyle. Achieving balance is safer through qualified professional guidance. How to make safe choices in supplementation. Responsible supplementation begins with an assessment of real individual needs. Laboratory tests can identify specific deficiencies before starting supplements. A varied and balanced diet is always the first line to get nutrients. When supplementation is necessary, product quality makes a significant difference. Look for supplements tested by independent labs for purity and potency. Read labels carefully and avoid products with unnecessary or questionable ingredients. Always start with low doses and gradually increase as directed by a professional. Keep a journal to record any changes in energy, mood, or symptoms. Consult periodically with professionals to adjust your strategy as needed. Remember that supplementation is a tool, not a replacement for a healthy lifestyle. Regular exercise, adequate sleep, and stress management are key. The human body is complex and deserves a holistic approach for optimal health. Invest in ongoing nutrition education from reliable, evidence-based sources. Building a personalized approach. Each person has unique nutritional needs based on multiple factors. Genetics, age, gender, activity level, and health conditions all influence these needs. What works for a friend or family member may not be appropriate for you. Work with professionals who consider your individual situation as a whole. Avoid following trends in supplementation without adequate research on its personal relevance. Consider working with an integrative doctor or nutritionist who specializes in supplementation. Monitor results through symptoms, energy, and laboratory tests when appropriate. Be prepared to adjust your approach based on how your body responds. Patience is important. Real change takes time and consistency. Communicate openly with all of your healthcare providers about supplements. Stay informed about new research, but be wary of passing fads. Health is a long journey where sustainable decisions trump quick fixes. Celebrate small improvements and maintain a realistic perspective on results. Integrating knowledge with mindful practice. Understanding interactions between vitamins is only part of a holistic approach to health. Prevention is always preferable and more economical than treatment of disabilities. Whole foods provide nutrients in forms that the body recognizes better. The bioavailability of vitamins in foods is generally superior to that of isolated supplements. Consider supplementation as a complement, not a substitute, for a nutritious diet. Develop relationships with health professionals who respect your autonomy. Look for providers who base recommendations on current scientific evidence. Avoid professionals who make unrealistic promises or apply a one-size-fits-all approach. Continuing education about your own health is a valuable long-term investment. Share knowledge responsibly with others, always citing reliable sources. Remain skeptical of sensationalist claims about miracle cures or simple solutions. The journey to optimal health requires commitment, patience, and adaptability. Recognize that nutritional science continues to evolve with new discoveries. Keep an open mind to adjust approach based on emerging evidence. Next steps for your health journey. If you currently use multiple supplements, review your list with a qualified professional. Identify which nutrients you really need, based on appropriate laboratory testing. Organize a system to take supplements consistently and at the optimal time. Consider using an app or journal to track how you feel about changes. Prioritize lifestyle changes that support natural nutrient absorption. Improve sleep quality exercise regularly, and manage stress effectively. Increase consumption of whole foods, focusing on variety of colors and textures. Stay hydrated properly, as water is essential for nutrient absorption. Develop eating habits that you can sustainably maintain over the long term. Surround yourself with community that supports your healthy life choices. Continue learning about nutrition from reputable, evidence-based sources. Celebrate progress, even a small one, toward better health and vitality. Remember that smart supplementation is a powerful tool when used appropriately. Your future health is built by the choices you make today. Start where you are, use what you have, do what you can. Knowledge combined with conscious action is the path to lasting vitality. Thank you for taking the time to learn about important interactions between vitamins. Your health journey is unique and deserves a personalized and respectful approach. Always consult qualified professionals for guidance specific to your situation. Stay curious, keep learning, and keep prioritizing your health consciously.